Hello, Dr. Keysmith with you on behalf of the Free Market Medical Association. My friend Jack Brown from Oregon has reminded me of a term that I was familiar with but one I never use, but one I'm going to start using: disintermediation, a term which describes the removal of all unnecessary parties in any market exchange. Disintermediation as a term characterizes the activities and the mission of the Free Market Medical Association, after all, an association that is designed to connect buyers and sellers with only the intermediaries that facilitate these exchanges. This makes the prices very clear, undistorted, and invariably lower and more value-based. I'd like to give you an example of how disintermediation has worked, and an example I know about personally. A friend of mine takes a drug called Topamax, which is used for headache suppression. The pharmacist goofed when they filled it the last time and left this friend of mine with a 1-month supply short. So they had everything they needed except a month. A 1-month supply, 60 pills, was quoted to this friend of mine a little over $500. Several calls were made, one of which was that I made for this friend to a direct primary care doctor, a good friend of mine, Jeffrey Davenport. He was able to get this drug, all 60 pills, for $18. All of the layers were stripped away, and that was the true cost of the drug. The people that made the Topamax were not losing money selling that to the wholesaler from whom Dr. Davenport in his direct primary care practice had secured this drug. They were making money and were happy to accept $18 for 16 pills. This is a good example of the power of disintermediation, and it's not uncommon that surgeries, for instance, at the Surgery Center of Oklahoma are 1/6 or 1/10 of what the big so-called not-for-profit hospitals charge for the same thing, primarily because all of the layers have been stripped away and the buyer and the seller are interacting directly. This is a powerful example, a personal example. I want to thank Jack Brown for reminding me that this term needs to be used more, and I will use it more, Jack. Hope to see you all at the conference in the next couple of days. There are some last-minute seats that remain. The details are at fmma.org should you wish to attend.